This is the Living in Mid-Bloom podcast, lighthearted and heartfelt conversations about what it looks like to live, heal, and blossom in middle age. I'm your host, April Pruitt. Let's get our bloom on. The information provided in this podcast is for educational and informational purposes only. While we strive to ensure the accuracy of the content, Medicare rules and regulations are subject to change, and individual circumstances may vary. This podcast is not intended to be a substitute for professional advice or consultation with a licensed Medicare broker or healthcare provider. We encourage listeners to consult with qualified experts to obtain advice tailored to their specific needs before making any decisions regarding their Medicare coverage. Neither the host nor the guest is liable for any errors, omissions, or actions taken based on the information discussed in this episode. Well, hello, mid-bloomers. How is everybody doing? Thank you for joining me on this episode. This is a very special episode about Medicare. I know several of you are either already in Medicare or you're joining for the first time this year, or you're just thinking about in the future what choices would be made best for you. So I have a young lady with me. Name is Stacey Haberstroh. Stacey is a Medicare broker, and the name of her business is Senior Insurance Concepts. And she helps people like me make healthcare choices. I started Medicare for the first time last year. I wasn't working with Stacey, I was working with someone else. I won't say their name, but because of my lack of understanding, I didn't understand everything I did. I didn't know what questions to ask. And unfortunately, it looked like I was signed up for 2 supplemental plans versus 1. Now, if I had felt comfortable with that person, I would have called them and questioned them, but I didn't. But I was able to get money back from that whole process. So I guess my point is you just want to make sure you understand. It's okay to ask questions. And I think part of this for today is I just want to kind of give you a little head start for some of you that haven't even started the process, or again, if you haven't completed for this year. What's the deadline for this year, Stacey?
Thank you, April, for having me. I appreciate
Absolutely.
it. So if you are already in Medicare, right now we are in an annual open election period. So that means that you have got the opportunity to change your plans. That's a prescription drug plan or a Medicare Advantage plan. And the open enrollment is October 15th through December 7th of each year.
Okay. Okay, great. So there's still plenty of time if you want to make changes or you want to rethink maybe your choices. Please feel free to correct me, Stacey, just so I understand. I know there are a lot of changes that are happening this year, but let's start first with just generally speaking. So we have original Medicare, and then we have Medicare Advantage. Now, I have Medicare Advantage, and as I had asked you about this, I was in it last year, but I didn't understand it, is that after going through all the options, it fit best for me for one, because I don't have a huge income that would work best for me for original Medicare. Would that be right? I'm not saying that's the only reason why you would go in it, but it's kind of pay as you go as opposed to paying monthly for Medicare.
The reason actually that I opened up Senior Insurance Concept 10 years ago is exactly this reason, is that there are 2 ways to go about getting Medicare. And many brokers choose one or the other. Not many brokers choose both as far as being able to represent. So I did not like the fact that the seniors were not being educated on what their choices were.
Okay.
So
Okay.
that actually is exactly why in 2013, beginning of 2014, I decided to open up again the senior insurance concept. So I wanted everyone to be educated about Medicare. Medicare is an entitlement program. You've paid for it every paycheck. They've pulled a little bit out. You are entitled to it and you had to work for 10 years to get it. So really my job is to educate you what your choices are. So you have two choices to go about with Medicare. And the first choice is original Medicare, and that pays 80%. Do you mind if I just keep
No,
going with
please,
that, April?
please.
That direction?
Yes.
Okay. Got it. So you have original Medicare, and as I have kind of coined it, is that I call it a prepay. So you have to pay for Medicare in order to get into the
Right.
system. Right. The example that I use there is we can't go to Six Flags and say, hey, I would like to just ride the Screaming Eagle 2 times. That's it. I just want to pay what's it going to cost me to ride the Screaming Eagle 2 times. They say, no, Stacy, you can't just buy 2 tickets to the Screaming Eagle. You have to buy a ticket to get into the park. Well, that's how Medicare operates. We have to buy that ticket. We have to pay that amount to get into Medicare. It doesn't matter which way you get your Medicare, you have to maintain that.
Okay. That's a great
And we know
analogy. That's a
actually,
great analogy.
thanks. I have a couple of them and they're really rudimentary, but you really understand it. So they actually just announced today what the cost for being into the Medicare program is. And for next year, that's going to be $185 for Part B premium.
Okay.
So they're going to increase your Social Security a little bit, and then they're going to increase your Part B a little bit. I don't know why they do that, but
Yeah.
they didn't call me and ask my opinion because I definitely would have shared
Now,
it.
what are we paying for
So
Part B right now? Okay.
175.
Okay.
So I think it's technically 174.90, but we've rounded it up. 175 this year, and next year it will be 185.
Okay. Okay.
So original Medicare, we sign up and original Medicare pays 80%. Now here comes another analogy that is a little bit rudimentary, but everyone will understand. So if you have ever gone to a parade and there's been horses in the parade, I always ask, what comes behind the horses?
Hmm. Okay.
April, do you know what comes behind the horses? A pooper scooper picker upper. Right? So let's go back. Let's bring that back to Medicare. So Medicare pays 80%. So what comes behind Medicare to pick up the remaining balance? Well, it's not the pooper scooper upper, but is known as a Medicare supplement or a Medigap. Those two words mean the exact same thing. And that is confusing too, right? You know, some people call it a cup of joe. Some people say a cup of coffee. These words are used interchangeably as well as Medigap and a Medicare supplement. So let's go back. Original Medicare pays 80% and a Medigap, a Medicare supplement walks behind it and picks up the remaining balance.
Okay.
Right? So you don't have to worry about it. There's no network. Wherever they accept Medicare, whatever Medicare chooses to pay, the supplement just walks behind it. And those supplements are based on your age and your sex.
Okay.
Men are always more expensive in the insurance world. And I say, hey, I'll pay for more insurance if you guys want to carry the babies, right? If you want to do that. So men are always more expensive than women. That's just a good to know. So you would pay a Medicare supplement, and that price, that going price again, based on sex and age, is about, let's just say a little on the high side, but for easy math, it's about $200 a month.
Okay.
Let's just say easy
So
math. That's a
so
little
this
high.
is original Medicare that we're talking about.
Uh-huh.
Okay.
Uh-huh.
Okay.
We have original Medicare and a Medicare supplement, and then we get to purchase a Part D,
For prescription.
a drug plan. I'm going to table the
Okay.
prescriptions for right now. I'd like to come back to it because that's a whole nother
Okay.
ball of wax. So that is one way. And I call that a prepay. You're paying for that Medicare supplement each month and that prescription drug plan. You're paying for that each month, whether you use it or not.
Okay. Okay.
But it's a stagnant, right? So we can put that $200 in our budget. So it doesn't matter what happens to our health. If we don't use it, we still have to pay for that Medicare supplement. But if we have to take an ambulance, a helicopter ride for our health, see the doctor 15 times and spend 21 days in the hospital in ICU, we don't pay any more.
Okay.
But that premium,
Gotcha.
that
Okay.
so that is a prepay. And I also think it does fit in budgets because we know no matter what's going to happen, we won't be paying more than that.
Okay. Okay. So we're
So
saying 100% is taken care of under those circumstances.
you're right. We do have to pay. It depends on what plan. There's 10 different Medicare supplement
Okay.
plans,
Okay. Which
right?
we will not
And it's,
go into, but to me, that is
I know,
very, very clear when we're talking about the original Medicare.
and those supplements are listed on page 76 of the 2025 Medicare and You booklet, page 76. What I want to also say, a big takeaway about a Medicare supplement is the Medicare supplement are standardized. So if you're going to choose, let's say, a plan G as in good girl, the plan G is the same in every single company. They are standardized. So it doesn't matter if you have United Healthcare or Anthem or Mutual or Physicians or Cigna. It doesn't matter. They all offer the same service. So the only difference is how much you pay a month for it.
Gotcha. One other thing, and then let's go to Advantage. That so
Oh,
during this period, I don't know if this is new. You can let me know that if you're, say, you were in original Medicare last year, and you can decide to go to Medicare Advantage this year. Has that
you
always
can.
been allowed that each year you can determine? Okay.
You can always go from a Medicare supplement or what I call prepay. You can always go from that plan to a Medicare Advantage
Okay.
plan.
Okay.
So, should we jump into the Medicare Advantage plan?
Yes. Yes.
Okay, so that really is the Medicare Advantage plan, is also known as Part C, C as in cat, right? So what they have done is that they've come up with a plan C, and I always tell people to make a C with your hand and turn it on the side, and it makes an umbrella. So everything is under this umbrella. Your Medicare Part A, your hospitalization, your medical, and your drug. It's an all in one plan.
Okay.
So, how this works is completely the opposite way. And this is a pay as you go. A large majority of them in our area are zero monthly premiums. So, you have to be into Medicare Part B. Remember back to Six Flags? You got to be in the park. So, that 185 will not change. You have to continue to pay that. And many people don't realize that they pay that because they come in and they take it out of your Social Security check before they ever send it to you.
Yes. Yes.
If some people aren't getting Social Security, they'll get a quarterly bill. And so they think they're paying $600, right? Oh my, I get a lot of those phone calls.
Oh, okay.
They're like, I just got a $600 bill from Medicare. You're like, well, that's for 3 months, right?
Okay.
545, I guess it is 3 months. So the Medicare Advantage Part C, there's a lot of HMOs and there's a lot of PPOs. And I want to point out in the 2025 Medicare and You booklet, the last pages starting on, I think it's page 122, is where they list all of the Medicare Advantage plans. So those are located in your book, in your Medicare and You book, in the very back of the book.
Okay. Okay.
So how those work is that you do not pay a monthly premium, got to pay your Part B premium, but you'd make no other additional premium payment And every time you use a service, you pay. So you pay as you go. So if you go to have a outpatient surgery, you'll have a copayment. If you go into the hospital for a couple days, you have to pay a copayment per day. If you have physical therapy, you make a copayment every time you go. So where the Medicare supplement is a prepay, you pay each month. The Medicare Advantage plans, I call it as a pay as you go. They don't have a cost to go see primary care doctors, but if you have a specialist or any other type of services you need done, you have a copay. Of course, all of the primary preventative care is at no cost. But other than that, yeah, so let's do a comparison. If you are in a Medicare Advantage plan and you go out to your mailbox and you slip and you fall and you break your femur, you're going to pay for an ambulance ride. You're going to pay for a couple days in the hospital. It's usually about, I'm going to estimation about $300 a day in the hospital. And then you're going to have to probably, with a broken femur, go to a skilled facility. You'll have some co-payments for that. And when you get out, you'll have physical therapy and you'll have to make a co-payment every time you use physical therapy. So you can see the difference of prepay and pay as you go. The pay as you go plan has got a maximum out of pocket protection built into it. I call it max out of pocket. And that is also located in the back of the Medicare and U book. It's called an out of pocket max, you will see. So you have a built-in stop loss. You have a built-in protection in these Advantage plans. The average one is about 2,500 all the way up to 5,000. So you want to make sure that you're in the plan that's got a reasonable or low maximum out of pocket. So every time you use a service on the Medicare Advantage plans, you make a copay and the copay is added together. So when you have spent $2,500, if that's your max out of pocket, if you have spent $2,500, then you do not have to pay any more copayments for the rest of the year.
Okay. Okay.
So you add up your copayments. So that's back to the Medicare supplement where you would pay $200 a month, whether you use it or not. And if you have that broken femur, then you won't pay more than $200 on a Medicare supplement. On a Medicare Advantage plan, maybe you don't use it in March, February, April. You wouldn't have any cost. But if you broke your femur, then you'd probably very well hit that $2,500 max out of pocket. You could do that within a month, right?
Mm-hmm. Mm-hmm.
But you, the consumer, have to pay attention. The doctors don't say, hey, April, we've noticed you've reached your max out of pocket. You don't have to pay anything. That's your responsibility,
Yeah.
April, is to go, wait, hold on. I've called customer service and customer service says that I've used $2,117. So you
Right.
know what your cost is there. Yeah.
Yes, that makes
But I,
perfectly good sense. And you're right. You have to pay attention to all of this. And I think the
yeah.
way you've explained it, to me, it appears clear. But I
Thank you.
remember calling you like, wait a minute, I don't understand this. I don't understand that. And,
Sure.
once I calmed down and I realized, okay, it's not that complicated. Yes, there
It
are moving
is.
parts, but the other piece of this is that, of course, they can contact Medicare directly. And I just want to throw this in that you don't have to use a Medicare broker. You don't pay for the Medicare broker. I believe it's at the private companies that pay your fee. I just want to be clear.
The insurance company pays us for
Okay.
enrollment.
Okay.
So each year we're required to certify with each company and certify through AHIP, a national organization, or we have to certify. And with each company, we're required to do their certification and attend their training.
Okay.
So we as brokers are not able to charge, but the insurance company pays us an enrollment fee.
Okay. When did the Advantage plan come into play?
Early 2000s.
Okay. Providing folks with an additional option is great, and I'm hoping in the future that you keep hearing these stories of, well, it's going to go away or it's going to be more expensive. But I think the key is just keeping current on what's going on and to ask questions. You've been my broker for this year, and I thank you so much. And I want to
Oh,
let folks
sure.
know that in addition to the state of Missouri, you are licensed in other states, correct?
Yes. Illinois and Missouri and Florida and South Carolina and Arizona.
Okay. And I'll be sure to have that information, your information on the platform, along with the states that you're able to help folks, and also the contact information for Medicare if folks want to contact them directly. They have folks that can help you as well. So, for changes for this year, was there a change in, I think, in Plan D?
Mhm.
D?
Yeah. So let's get a little history on D, on the drug plan. D is the prescription drug plan, and it came into existence in 2006. So before that, we didn't have a drug plan. It wasn't regulated. You just kind of paid what was asked, right? So that became a problem. So we came up with the prescription drug plan, Part D. Let's review real quick. Part A is hospitalization. Part B is medical. So that's everything outside of the hospital. Part C is in CAT, is the Medicare Advantage plan, and D is for drugs. So we have had the Inflation Reduction CARES Act of 22. So we have had a strategy and we've been trying to reduce the drug costs since 2002 when we identified that the current drug plan, offered you coverage and then it reached a point where it stopped offering you coverage. You had a donut hole or a gap. So all of a sudden people are tracking along, paying copays for their drugs, and they reached a certain point about $2,700 out of pocket, and then they had to pay for 100%
Whoa.
coverage. So we had diabetics all of a sudden paying $35 for insulin, and they walk in and now they have to pay
Oh my
$350
gosh.
for insulin. So of course they're not going to pay for that. And of course, really what happened is that then we saw a huge uprise of diabetics ending up in the emergency room because their sugars were off or they couldn't afford it or they didn't take it. And
Yeah, that's
so
scary.
we went, wait a second, we need to have a strategy. I think that was our first indicator. So what they did is they said all insulins are $35 year round, period. Don't pass go. You can only pay $35. So then that balanced out the diabetics. They weren't going in and out of urgent care and in and out of the hospital and having bigger complications for lack of taking
And that's
insulin.
me. That's me. So I appreciate that. I appreciate that
Yeah,
very much.
right, right. I mean, it just makes sense. So, what is happening this year? There's been some changes in percentage of responsibilities of drugs, but this year is a big year. So, in 2025, the most that you can pay out of your pocket for prescription drugs is $2,000.
Okay. Okay.
Sounds like a lot if you're not taking it, and it sounds like a fabulous if you're taking it. I've got several clients that are spending $8,000 to $12,000 a year on prescription
Oh my
medication.
gosh.
It's changing their lifestyle. They've downsized. They're nervous,
Yeah.
right? And
Yeah.
so these people are really the ones that need the help. The most that you can spend out of your pocket on prescription drugs for 2025 is $2,000. So we've seen a big change in the industry. We had a lot of companies that were offering Part D plans and several of them. And I think that the amount of availability is cutting in half. Several people, Mutual of Omaha is one of them. Listeners, if you have a Mutual of Omaha prescription drug plan, then you really need to look for another one because they're leaving the market. Silver Scripts, yep, they should be notified, but just in case you haven't been, Silver Script is an Aetna plan. They had 3 drug coverages and now everyone's being rolled into one.
Okay.
So we've had a lot of changes. So this really is the year that you need to contact your broker and make sure that you are in the correct plan for next year. So with give comes take,
Yeah.
right? So we are seeing a $590 deductible in the prescription drug plans.
Okay. Okay.
That's the max that it can be. Now, we've not seen this large of a deductible. And as well as we've really not seen a deductible in the Medicare Advantage plans, but we will this year. So if you're in a Medicare Advantage plan, you could have a $200, $300, $400 deductible in your drug portion. We've never had one before, so I think that's going to catch a lot of people by surprise when they go in January 1 to pick up that insulin or to pick up that newer brand name drug because you're going to have to pay up to $590.
Yeah, I remember our discussion about that. Yeah. Yeah.
Yeah. But I want to let people know about the Medicare prescription payment plan. And that information is located on page 83 in the 2025 Medicare and You book. So this is a new plan. So it's a payment option that works with your current drug coverage to help you manage your out-of-pocket drug costs. You're going to spread them across the calendar year. So I kind of call it like a reverse layaway plan, right? They're dividing that cost into 12 payments. So this payment option will help you manage your expenses.
Okay.
It doesn't save you any money or it doesn't lower your drug cost, but you are able to have a payment option where you will pay for it in 12 months
Versus a big chunk.
versus a big
Yeah.
chunk. You are able to call your company. So I would let everything settle with open enrollment and I would start having everybody call their insurance company around the 15th of December. The new insurance company, if you're taking one, and say, hey, I would like to volunteer into this Medicare prescription payment plan.
Okay.
And so you are ready to go. When you walk into that pharmacy, you don't pay for those drugs at the pharmacy. The pharmacy now has to go back to your drug company and get the payment. And then your drug company will send you a bill like, okay, you had a $590 deductible, April, right? So now we're going to go ahead and divide that $590 by 12. So you're only going to have to pay us $50 a month.
Okay.
And
Having that option is fantastic. Really makes
it
a
is an
difference in somebody's lifestyle.
absolutely, as well as you can do it. I was talking to a pharmacist last night and he said when people come in and, they're standing at my counter shell shocked, like, you want how much?
Yeah.
How much you want?
Yeah.
That he can call at that point. But I think that puts a lot of pressure on the pharmacy, but it can be done. So my recommendation is let's call our company. The customer service number is located on the back of your cards, whether it's an Advantage plan or it's a standalone drug plan.
Mhm.
Call in December and get yourself set up for that so we're not in a knee jerk come January 1.
That makes great sense. And that's just great information. I appreciate you sharing that.
Sure.
We've
Those
done a great job of kind of focusing on the difference in the original plan versus the Advantage plan, the changes in Medicare Part D drug plan, confirming that if you were in the original Medicare last year, you can go to Advantage this year. And just the opposite. If you were at Advantage last year, you can go into original Medicare this year.
let me correct you there a little bit, Miss April, is that if you are in a Medicare Advantage plan, you can go back to original Medicare, absolutely, but you're not guaranteed to get into a Medicare supplement.
Oh, okay.
How you can get into a Medicare supplement is when you turn 65 and or enter the Medicare system. Some people are working until 70 and that's when they're entering the Medicare system. But when you originally enter, it's called your initial enrollment period. You are able to pick, I want to do an Advantage plan or I want to do a supplement with no health questions. It doesn't matter. You could be holding your lungs with an amputation, smoking a cigarette, waiting for a new kidney. Doesn't matter. There's no health questions when you initially enter the Medicare system.
Okay. Yep. Yep. That's true.
So if you start with an Advantage plan, and I see this as a common mistake of people will make the decision of an Advantage plan based on their current health. Well, I'm healthy now, but we're not making this decision for now. We are making this decision till death do us part.
Okay.
Because if you start on an Advantage plan, and then you decide, wait a second, I'm a heavy user, or wait a second, I don't want to have to stay in a network, or I don't want to have a gatekeeper. I don't want to have to seek, get approval for physical therapy. I want to go back to a supplement. You will have to answer health questions. It's called underwriting. You will have to go through underwriting.
Okay.
So there's a series of about 15 loaded health questions that you have to say no to all of them. So that's, I think that again, why I started this company 10 years ago is that people are not being educated. I get phone calls all day about my mom is 85. I just had to put her into a nursing home, and the house doctor and the physical therapy is not in network in her Advantage plan. I want to put her in original Medicare and a supplement. I say, your mom's not going to qualify.
Wow. Obvious
And they say,
to the
what?
nursing, there are obvious health issues, major health issues.
Correct.
Wow. Okay. That
So I think that we're a bit confused. I know that, the marketplace was a big deal and Obamacare, as they called it. I think that was a great, great plan. Wonderful. I'm on it myself. However, it confused us because there's no pre-existing from 65 and below, right? So it doesn't matter what my health is right now as a young 29-year-old female. It doesn't matter because I would be on the marketplace. But what happens is at 65, there very much is pre-existing. A Medicare supplement can reject you, and they do based on your health.
right, and how much it's going to cost them.
Yeah, based on the health. So I'm a fan of both ways. It doesn't matter to me which way people choose to go about getting their Medicare as long as they know.
They need to
If
understand what those
yeah,
choices or what choices they think they have may require,
sure.
like you said, a review of your health to determine if you're saying you want to go into original Medicare after being an Advantage, that there's this entire process to go through.
Right. Because no one wants to be only on original Medicare
Yeah.
because we have a 20% liability until the cows come home. 20% liable for chemo, radiation, like that's just not a safe
Yeah.
move.
Yeah.
So original Medicare by itself is just not a good move. But I just think that that people need to know
Yeah. No, that's
so that you know what that choice that you're
yeah.
making,
Yeah.
right? I mean,
And and again, and I say not knowing what questions to ask. So I'm glad I made a mistake by saying that, so we could cover that. We actually set that up on purpose, right?
yeah, we did. I know you're texting me on the side, like, don't forget to segue. Yeah. And you're more than welcome to call Medicare. You had said that earlier, but Medicare's not a licensed agent that's been doing this for 20
Yeah.
years.
Yeah.
right? So, I mean, they'll tell you your yeses and your no and your no's. Like, oh, yes, you can do that. No, you can't do that. And, April, that's what you said when you first signed up. Like, you weren't given this opportunity to make this
Right.
choice. Right? You didn't say, hey, and again, I think the Advantage plans serve their purpose. I have hundreds of people that are on them, and they're great plans as long as you realize that you're going to be in that plan. And here's another thing that you really need to be talking to the daughters here, that if you're going to be helping your mom move into an assisted living or a senior facility or skilled, you need to know what if the house doctor is on her plan.
Right.
Right. I was just on the phone minutes before we clicked in with a woman that said, I moved my mom in, and the plan that she's on, the doctor and the physical therapy doesn't take. Now, don't you think that if that facility said, hey, this is who we take, let's line up your mom's insurance. Right now, this daughter has put her mom in there. Now she still has to go and pick her up and navigate taking her out and taking her to her primary till the first of the year during open enrollment, when we can switch her insurance to have it lined up with the physical therapy or house doctor.
Yeah.
So it's kind of a bigger picture, right? That we don't realize that really everyone should lead with insurance.
Yeah. You're right. No, you're right.
So you kind of have to have someone that looks at the big picture, where these volunteer organizations bring a service to the table. They certainly do, but they don't have that insurance side of it. I do want to say, if you are in a Medicare supplement now, you are allowed to go to a Medicare Advantage plan for 1 year and give it a try. I got lots of clients that went, wait a second, I feel like I'm paying a lot for the supplement and none of my friends are paying anything, and maybe I want to do that. Well, you can go try a Medicare Advantage plan for 1 year and go back to your Medicare supplement without any health questions. But if you stay in that Medicare supplement 13 months, then you're out. So they do allow you to go from a med sup and to try an Advantage plan for a year and see if you like getting your care that way. And if you go, oh gosh, I don't like it, that's not what I thought it was going to be, you can go back to the original supplement that you have. For example, if you're in an Anthem, Blue Cross Blue Shield Medicare supplement, which, by the way, will not be affected with the Little Mercy Anthem middle school girl fight that they're having here in St. Louis. You Medicare supplement, you can go ahead and go to a Medicare Advantage plan and try it for a year and go back to your Anthem Medicare supplement.
Without any pre-approval.
Without any health questions. Yeah.
That's great to know. Thank you so much for this information and answering questions that I know people have. I will have all of your information on the platform, where you're licensed, and I'll also have the Medicare information out there too for everyone. But everyone, please make informed decisions, and it's okay to ask questions if you're not clear. That's what a broker is there for you. Again, thank you, Stacey. I so appreciate it.
No problem. Thanks for having me on. I'm glad that we got to get together before open enrollment. We've got plenty of time, April, plenty of time.
Okay, great, my dear. Well, you have a wonderful day, ma'am.
You too.
Okay.
Call with any questions.
Will do. Thank you for joining me today on Living in Midbloom. I hope you found this episode insightful, meaningful, and maybe it's given you something to think about. I invite you to share your positive reviews or ideas on topics you would like me to touch on by leaving your comments on Apple Podcasts, Spotify, CastBox, Podchaser, or Podcast Addict. We are all divine beings who just want to be seen, heard, and loved. Have a beautiful day.